By the end of this video, you will be able to describe the steps of the Massive Haemorrhage Protocol and the role of the transfusion laboratory. Rapid and correct blood component delivery saves lives. Massive hemorrhage is defined as the loss of one blood volume within 24 hours, or 50% within 3 hours. It is a medical emergency requiring immediate laboratory and clinical coordination. Major trauma, obstetric hemorrhage, gastrointestinal bleeding, major surgery. The clinical team activates the protocol by urgently contacting the transfusion laboratory. Clear communication and correct patient identification are essential. Emergency Group O. Red cells are issued according to local policy, either O negative or O positive, before the patient's blood group is known. A balanced transfusion approach is used. Red cells, plasma and platelets. A 1:1:1 ratio may be followed where locally applicable. Fibrinogen replacement is provided using cryoprecipitate or fibrinogen concentrate. FBC, PT, APTT and fibrinogen are monitored. A blood group and cross-match are performed once a sample is received. Rapid component selection and issue, maintaining traceability and documentation, monitoring stock levels, continuous communication with the clinical team. Ensure urgent samples are correctly labeled and transported without delay. Once the patient's group is confirmed, switch from emergency O blood to group-specific units to preserve O negative stock. Hypothermia, dilutional coagulopathy, hypocalcemia. Timely component delivery reduces these risks. Wrong patient details, failure to activate MHP, poor lab and clinical communication. Activation, emergency blood, balanced components, laboratory monitoring, group-specific blood. This video is for educational purposes only and not for clinical decision-making.